For me, any advice I can give a newly diagnosed patient is, once I found out I was gonna have the Da Vinci surgery, oh, I YouTubed it. I went crazy, and my wife was, "What are you doing? Why are you watching it?" And I'm sitting there like, "Do you see what they're gonna do to me?" There's a lot of horror stories out there, and I think I heard more horror stories than good stories. That was scary for me, because here I was getting ready to go through this procedure, and I'm hearing all this bad stuff. Whatever questions I had from my doctor, I would ask him. And you know what? If you have a really good doctor, he should be able to answer anything you have for him. And the other advice I would give is, have somebody to talk to. You know, I had my wife, and I could talk to her, but I had another guy friend who also was there for me, who I could just tell him how scared I was, how worried I was. And I think that's the whole thing with being a man, is you can't let people see you down. You can't let people know that you're crying, that you're hurt. And I was 39, and I could possibly not see my kids again. I didn't tell a lot of people, because I didn't want people to be like, "Oh, I'm so sorry to hear that you got prostate cancer. That sucks." So whoever I shared that I had prostate cancer with was somebody I knew would lift me up. Slowly it went from why me, why me, why me, to why not me? Why not me? I can go up to anybody and talk to anybody, so why not me?
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.